TMD is a condition that affects the jaw area, resulting in pain over the jaw and the side of the face. A stiffness feeling in the area can also give you a temporal headache and can be linked with teeth grinding. It is generally caused by an increase in muscle tension around the jaw, so activities that use these muscles, such as chewing, will often aggravate the pain. The increase in tension is often linked with a process called central sensitization, a change in the way your nervous system controls your body, usually linked with an overactive and overused stress response. Think of the fight or flight response. One of the things that happens when activated is your muscles get more switched on to get you ready to run or fight. However, if your fight or flight is active too much or for long periods, the muscles become chronically stiff. Most people feel this in their neck and shoulders. Some, it refers to the skull to give tension headaches, and for some people it will travel to their facial muscles. You might also notice other symptoms of an overactive stress response, such as IBS, chronic fatigue and poor sleep, and the symptoms generally get worse the more stressed you are. If muscles are tight for a long time, the tension creates more pressure on the blood vessels in the area, so the muscles become ischemic, meaning they have less oxygen supplied to them, as oxygen is carried in blood. The muscle's metabolism is affected by low oxygen levels, so they start to work with not enough oxygen, and this results in the release of metabolic byproducts, such as lactic acid, that makes muscles feel stiff and sore. Treatment is going to need to identify and treat the cause of the altered nervous system, and that is going to be very individualised. But for symptom relief, here are my top 3 treatments. Cupping over the jaw lifts and frees up the tight tissues. It also improves blood flow and encourages new blood vessel growth. It should instantly feel a bit freer and less painful after the treatment. Using my index and middle finger, I like to apply traction to the acupuncture points gallbladder 20 and bladder 10. They are in the depressions either side of the middle, right under the back of the skull. The cranium has a parasympathetic nerve supply. This is the opposite side of the scale to the fight or flight response and will essentially calm it down. If it is tight there, which it generally is with someone who has TMD, the depressions where the points are will feel really taut, and as you continue to apply pressure, they will gradually soften and release the tension there. This will in turn help with the temporal area pain that is normally referred from there, and will help with the relaxation of the muscles in the area, including the jaw. Large intestine 4 is known as the master point for any issues with the face. Therefore, it helps with facial pain, and also is a wind relieving point, so it helps to release any upper body tension. It has a strong effect on central sensitization, so can calm that stress response down. There are lots of studies about this point and is understandably one of the most commonly used points.